Hi, my name is Alistair Kirikou. This video is for the assessment task number 1, the external jugular vein access. The indications for the external jugular vein access include the emergent access and for the administration of fluids and or medications where peripheral access has been unachievable. Contraindications include the uncooperative patient due to the location of the insertion site, very dangerous if they're not cooperative, and it should be reserved solely for the critically unwell patient to administer medications, sedation, ongoing fluid and paralysis. Complications and precautions that can arise from this procedure include needle stick injury, pneumothoraces, arterial puncture, nerve puncture, musculature puncture resulting in hematoma, and as like any other peripheral access, local or systemic infection. Before you can begin, we have to locate our target landmarks for insertion. The external jugular vein is formed with branches of the external auricular vein as well as the external facial vein. It then branches obliquely backwards over the sternomastoid muscle and inserts deep into the neck fascia, midway between the clavicle and inserting deep into the subclavian vein. Our target insertion point will be superior as possible of the external jugular vein to reduce the risk of pneumothoraces. Once we've located our target insertion sites, we have to engorge the external jugular vein to allow ease of access. Now we can't obviously put a normal venous tourniquet on or we'll choke our patient. So there's a few ways that we can distend our vein to ensure ease of access. If appropriate and if able, allowing the patient to bear down as if completing a Valsalva maneuver will increase the central venous pressure and in turn increase the jugular vein pressure. You can raise the patient's legs, or most clinically appropriate and to reduce the risk of their embolus is to lie the patient as supine as possible. With C-spine precautions in mind, a 45 to 60 degree head tilt to the opposite side will allow for ease of access when inserting. So for the procedure in external jugular, the equipment you require is your standard precautions, gloves, goggles and mask. For this video, I actually won't be using a mask just due to the sound quality. Follow your local state's guidelines into regards to your antimicrobial wipes. The appropriate size cannula, I like a 16 gauge, it gives a good balance between flow rate and extravasation does not occur. A 3-way tap with a J-loop extension, a large 20mm flush, aseptic tegaderm, tape, gauze. These procedures are notoriously hard to occlude, so therefore they can bleed, and a sharps container to dispose of your needles. Once you've located your insertion and prepared your patient, you can begin. Appropriately clean your insertion site as per your local state's guidelines and allow to air dry. From here, we need to increase the JVP further. We can't apply a venous tourniquet as per normal, otherwise you would choke your patient. So there's a few ways you can go about this. You can enlist the help of a partner to use their thumb and apply gentle pressure to engorge the vein. I personally don't like this because it will increase the risk of needle stick injury. What I like to do is use my own thumb to apply that pressure and also allows to stabilise the vein. From here, using the appropriate cannula size, go in as per normal to ensure you get flashback. Once you get flashback into the chamber, advance both the cannula and the needle further and occlude your cannula. Immediately dispose of your sharps in your sharps container and attach your pre-primed J-loop and 3-way extension. Apply your aseptic tegaderm to the hub. And confirm patency with a large 20mm flush. Once you're happy your patient's vein's been accessed, tape it down as per normal. I personally like a chevron, which is just a simple loop over the J-loop extension to ensure stabilisation, and a second piece of tape. From here we can monitor for extravasation, administer any fluids we require or medications and ongoing. That is how you insert an external jugular vein.